As with most guidelines, um, they are aspirational. That is, they are not enforceable as part of the ethics code, but they do inform professional practice. In other words, while a psychologist cannot be sanctioned for not adhering to the custody guidelines, cannot be sanctioned, say, by the American Psychological Association, um, it is still expected that professional practice will be informed by these guidelines. Now, it should be mentioned along these lines that state boards of psychology may, in fact, incorporate the guidelines into their administrative code. When they do that, it then does become part of the law, part of the legal standard, and can be enforced. In its current status, though, it is a guideline, which means it is aspirational rather than enforceable. But once it becomes part of a state code of conduct, professional regulations in a particular state, then it does become enforceable. So generally, looking at the child custody guidelines, the focus is on the best interests of the child. The child's welfare is paramount, and the evaluation should focus on the fit between the child's psychological needs and the parental attributes. This is an important kind of issue because it means that we're not necessarily looking for the good parent or the bad parent, or the parent who is good for the child and the one who is bad for the child. These cases, of course, get played out in the media and actually in the minds of many mental health professionals. For the most part, though, when we're looking at these issues and we have both parents who can provide for the child, we're basically looking on the fit between what the child's needs are and what the parental attributes are. So we have to sort of distance ourselves from the idea that one is a good parent or a better parent and one is a bad parent or not so good parent. Now, of course, there are certain situations, of course, when there is a documentation of abuse, when the child needs to be with the non-abusive parent. But again, these are not the majority of cases. We also have to look at the focus on the competency and impartiality of the child custody evaluators. This was not made absolutely clear in the prior version of the child custody guidelines. But here, because it is informed by the ethics code and by the forensic specialty guidelines, there is an emphasis on competency and impartiality. That the person has to be impartial, and what that means is evaluating the case from all sides, testing out plausible rival hypotheses, eventually reaching a conclusion based on a preponderance of evidence, not having any preconceived notions prior to going into the evaluation. Competency, again, as is determined in the same way that it is in the APA Ethics Code. Does the person have sufficient knowledge, experience, and training to conduct this particular evaluation? It should not be, like in the example I gave before, someone who has taken a workshop or a particular seminar in an area and then hangs out a shingle calling themselves an expert in this area. Again, consistent with the APA Ethics Code, the evaluations have to be non-discriminatory and culturally sensitive evaluations. There has to be an avoidance of multiple relationships. This bears a little bit of discussion. Um, Most psychologists realize that different roles are played by a psychologist treating an individual or a family, a mother, a father, or children, and an evaluator. The different role, of course, is first and foremost that the therapist is basically an ally, an advocate for the client or patient's needs, while the forensic evaluator is impartial and objective. Despite the many attempts on the part of many psychologists to mix these roles, to maintain that they can be objective and impartial and still be a therapist, these are roles which should be avoided if at all possible. Not only are there different assumptions, there are different assessment techniques offered when one is evaluating somebody in the course of therapy or prior to therapy. You are evaluating them in terms of the sort of therapy needed. You're not evaluating custody or visitation kinds of issues. You're not using a battery of psychological tests generally when you see somebody in psychotherapy. If you're doing a custody evaluation, or for that matter, any other kind of forensic evaluation, you are using a variety of different assessment techniques, including assessments that look at an issue of malingering, that is either exaggerating or minimizing psychopathology. These kinds of assessment instruments are not typically used in psychotherapy, and in fact could be very harmful to psychotherapy if the client feels that you are evaluating them to determine whether or not they are faking. From a legal point of view, there are totally different assumptions. If you are doing a forensic evaluation, a custody evaluation, unless it is court ordered, you are generally operating under what is called the umbrella of attorney-client privilege. What it comes out of that evaluation is regarded as confidential work product. That is to be shared only between you and the attorney until such time as they decide to use it in court, and then it can be made available to the other side. When you are treating somebody in psychotherapy, you are dealing with psychotherapist patient privilege, which has far fewer protections than attorney-client privilege. So these are just some of the reasons why multiple relationships should be avoided. One thing that should be clarified, though, is that when you are a therapist, you are not merely a fact witness. Some people say that if a therapist is called into court, they testify only as a fact witness, what is sometimes called a lay witness. This is not so. You are, in fact, testifying as an expert, but you're testifying as an expert on diagnosis, prognosis, treatment methods, and so on. You are not testifying on the forensic issues involved, the legal or psycho-legal issues involved. Okay, you need to also clarify the referral question very, very clearly. Very often in these settings you get a somewhat ambiguous referral question. You don't know exactly what is being asked. An attorney may request a general assessment. How are these kids doing? How are the parents doing? And the psychologist who is not sensitive to this may in fact go into this without knowing actually what questions are being asked. And then they find themselves coming into court and being asked very specific questions that they have really not addressed in their evaluations. They then are either in the position of having to say, I don't know, or they try to overgeneralize from their data, which can be even more damaging. One has to pay attention to what the scope of the evaluation is, and this is usually defined by the referral question. Different referral questions will dictate different kinds of assessment techniques and the relevant time frames. When is this case coming to court? How long will it take to prepare adequately the assessment needed for this? Psychologists have to become very sensitive in terms of being able to answer these questions. The last thing that I will comment on in terms of these custody evaluations is the whole area of informed consent. Informed consent really has two overlapping dimensions. These are the ethical and the legal aspects. Ethically, the APA Ethics Code requires that in any kind of forensic evaluation, child custody evaluations included, the psychologist must clarify who they are, what their role is. In other words, who it is that retained them. Is it one attorney, the other attorney, or the court? They have to clarify to whom, first of all, whether or not the evaluation is confidential. Most forensic evaluations are not confidential. Though they may be confident, they are not confidential in the sense of confidentiality between the client you're evaluating and the therapist. They may have attorney-client privilege, so there will be confidentiality in the results that they will be shared only with the attorney until the attorney decides what to do with them. Under any circumstances, the lack of confidentiality has to be made clear to the individual and the people to whom it will be disclosed. Will it be disclosed to one attorney, both attorneys, to the court, to other personnel within the court system, say for instance a guardian ad litem or a worker for child protective services? All of these disclosures have to be made, and the psychologist has to determine whether the person being evaluated is competent to understand those disclosures. If they are not competent to understand, if they cannot say back in their own words what these issues are, what the nature of disclosure is, then the evaluation should not go on absent a court order, or you're being given what is called substitute authority by one of the attorneys. Now, legally, informed consent consists of three different areas which overlap with the ethical. These three areas are called competence, voluntariness, and sufficiency of information. Competence we've already talked about. That is the person competent to understand what the nature of the assessment is and what the disclosures are all about. Secondly, voluntariness. Is the person participating in the evaluation voluntarily without coercion? Um, are their decisions autonomous decisions? And finally, sufficiency of information, which largely goes to that nature, that issue of disclosure, which I talked about a moment ago. Um, what the nature of the evaluation is, what issues it will address, and to whom disclosure will be made. All of these need to be part of the evaluation and documented ahead of time.